Assalamu alaikum. I am Sada Iqbal from final year morning. My roll number is BP 1650193. The antibiotic which I am going to discuss with you is gentamicin. Gentamicin is an aminoglycoside. It is a broad spectrum antibiotic. The mechanism of action of gentamicin is that it irreversibly inhibits protein synthesis of the bacteria. It does so by binding to the 30th subunit of ribosomal protein. There is a misreading of mRNA and incorrect amino acid is added into the growing peptide and there is chain termination. Addition of incorrect amino acid results in synthesis of abnormal protein that doesn't work properly. Rational use of drug means appropriate drug with a proven safety and efficacy for the right patient in the appropriate dose and dosage form at the proper interval of the time is given to the patient. Gentamicin is used in serious infections that are caused by gram-negative bacteria such as Pseudomonas aeruginosa and Serratia marcescens. It is used in the infections like endocarditis, infected burns, eye infections, meningitis, bacterial pneumonia, peritoneal dialysis associated peritonitis, skin lesions, and UTI. Irrational use is the unjustified use of a drug. Example, there is no clinical or lab evidence of infection is present, but still antibiotic is given, or prophylactic antibiotic therapy is prescribed in such circumstances in which it is of unproven efficacy, or the choice of antibiotic is inappropriate. Irrational use of gentamicin include its prophylactic use. It should not be used prophylactically as it is a broad spectrum antibiotic. Prophylactic use can result in bacterial resistance. Another irrational use of gentamicin is the long parenteral use of gentamicin in combination with other antibiotics in gynecological departments. There are two reasons that it should not be used prophylactically in gynecological departments. One is that it is a pregnancy category D drug, and second is that it causes vestibular and auditory nerve damage to the growing fetus. Pediatric dose of gentamicin is 2 to 2.5 mg per kg Q6 hourly. In adults, it is used in a dose of 2 mg per kg Q6 hourly or 5 to 7 mg per kg once daily for 2 to 4 weeks. The maximum prescribed dose of gentamicin is 5 mg per kg, maximum of 400 mg, and the minimum prescribed dose is 2.5 mg per kg, maximum of 180 mg. In geriatric population, dose adjustment is required, and also in the case of renally compromised patient, dose adjustment is needed according to the creatinine clearance of the individual. Dose adjustment is needed because this antibiotic has the potential to cause nephrotoxicity. It damages renal cells. Gentamicin starts accumulating in the body because it is excreted only by the kidney. Dose adjustment is done after calculating creatinine clearance. Commonly, we use Cockcroft-Gault formula for calculating the creatinine clearance of the individual. If the creatinine clearance of the patient is greater than 60 ml per minute, then the dosing interval is Q24 hourly. If the creatinine clearance is 40 to 59 ml per minute, then the dosing interval is Q36 hourly. And if the creatinine clearance is between 20 to 39 ml per minute, then the next dose is given after 48 hourly. And in the case where the creatinine clearance of the patient is less than 20 ml per minute, then it is better to avoid gentamicin. Monitoring of gentamicin is required or it is essential because of several reasons. As we know that it is a narrow therapeutic index drug, slight variation in the plasma levels can cause toxic effect. Another reason is that it can cause nephrotoxicity and ototoxicity. One more reason is that there is a age-dependent differences in the toxicity of the gentamicin, so monitoring is mandatory. In the case of the kidney insufficiency, again monitoring is required, and if the repeated therapy is given with gentamicin, then monitoring is also required. Peak levels are measured at a specified time following the last dose, and peak levels for the gentamicin should be between 4 to 12 milligram per liter, while the trough levels are measured at a specified time before the next dose, and trough levels for gentamicin should be between 1 to 2 milligram per liter. In the case of gentamicin overdose or gentamicin toxicity, pyridoxal 5' phosphate is used as an antidote. It is basically an active form of vitamin B6. It is used as an antidote because it readily complex with a wide variety of potentially toxic substances, including gentamicin. There are different dosage form of gentamicin are available. These include parenteral, include the intramuscular and IV dosage form. These are given in serious infections like in case of severe endocarditis. Topical dosage form include cream and ointment, and these are used for infected burns and skin lesions. Intraocular is used in the case of eye infection, and intrathecal is used in meningitis. There is one thing to know, that there is no oral dosage form of gentamicin is available, because when the gentamicin is administered orally, it doesn't get as absorbed into the blood. That is why we are not giving it orally. This slide is important with respect to the pharmaconomic point of view. Here, comparison of different dosage form and different brands of the same dosage form with respect to their price is given. You can see that in the case of the parenteral dosage form, ampule of one brand is available in 37 rupees, while the ampule of another brand with the same strength is available in 25 rupees. Side effects of gentamicin includes nephrotoxicity. Nephrotoxicity is basically the rapid deterioration of the kidney function. And nephrotoxicity is the result of inhibition of the protein synthesis in the renal cells, and there is necrosis of the renal tubular cells. Another side effect of gentamicin is the ototoxicity, and ototoxicity is the hearing and balance problem. Gentamicin causes ototoxicity by generating the free radicals within the inner ear, and these free radicals causes damage to the inner ear, and as a result, ototoxicity is produced. Gentamicin also causes neuromuscular blockade and the respiratory paralysis by decreasing the acetylcholine release. As we know that gentamicin is itself a nephrotoxic drug, so it should not be used, or it should be used carefully with other nephrotoxic drugs, for example, NSAIDs, amphotericin B, and cyclosporins. And with other ototoxic drugs, like for example, furosemide, gentamicin should be used very carefully. There are two alternate drugs that are available to us that we can use in the cases where gentamicin cannot be used because of several reasons. Number one is the ceftriaxone. Ceftriaxone is a third generation cephalosporin. It has a broad spectrum against both gram-positive and gram-negative bacteria, and it is a pregnancy category B drug. And it is safe in the patient with the renal insufficiency because it is excreted via both renal and hepatic pathway. The second alternative that is available to us is ciprofloxacin. Ciprofloxacin is a second generation broad spectrum fluoroquinolone, and it is active against both gram positive and gram negative bacteria. And ciprofloxacin is associated with the least side effect. It is a pregnancy category C drug, and it doesn't cause nephrotoxicity, but in the cases where the patients are renally compromised, dose adjustment for ciprofloxacin is required. Now we will discuss one case related to our drug, that is gentamicin. James is a 62-year-old 87 kg man who was admitted in the hospital with a heart failure symptom. He had undergone aortic and mitral valve replacement surgery. 5 days post-operation, purulent drainage is noticed from the surgical site, and he has chest pain, trouble breathing, weakness, and pain in hands. He is diagnosed with mediastinitis, and blood sample is sent for the culture test and found to be positive for Serratia marcescens. Culture is sensitive to the gentamicin and piperacillin. His past medical history includes the hypertension and atrial fibrillation, and currently he is taking enalapril, furosemide, and digoxin. His BP is 152/90 mm of Hg, respiratory rate is 26, and temperature is 37. His chief complaint is purulent drainage from the surgical side. His detail includes age 62 years, weight 87 kg, height 5 feet and 10 inches, and his BMI is 27.5, means he is overweight. His symptoms include chest pain, trouble breathing, weakness, and pain in hands. His past medical history includes hypertension and atrial fibrillation, while his past surgical history includes aortic and mitral valve replacement surgery. His current medication includes enalapril 5 mg per oral once daily, digoxin 0.25 mg per oral once daily, and furosemide 80 mg per oral Q12 hourly. His vital signs are given and blood is positive for the Serratia marcescens and culture is sensitive to the gentamicin and piperacillin. As the culture test has confirmed that the infection is caused by Serratia marcescens and purulent drainage from the surgical site is basically due to the mediastinitis, that is the inflammation of the chest area caused by infection. Serratia is basically an gram-negative bacteria. It is an opportunistic bacteria. It can cause nosocomial infection. And this case is basically the perfect example of the nosocomial infection caused by Serratia marcescens in a patient who has his history 5 days ago. His symptoms like shortness of breath and chest pain are also due to the inflammation of the chest area caused by the infection. Treatment plan include gentamicin and piperacillin. Gentamicin is given 180 milligram IVQ 48 hourly for 4 weeks and piperacillin 2.5 gram IVQ 24 hourly for 4 weeks. These two antibiotics are given because the culture is sensitive to these two. And monitoring plan include the monitoring of the BUN, that is the blood urea nitrogen, and the creatinine clearance. These two should be monitored because as we know that the patient is already hypertensive and we are giving gentamicin to him and we know that the gentamicin has the potential to cause a nephrotoxicity. So renal function should be monitored closely, and if there is increase in BUN or decrease in the creatinine clearance, then the problem should be addressed immediately and the dose adjustment should be done according to the creatinine clearance of the patient. And as we already mentioned that the furosemide is a ototoxic drug and the patient is using furosemide. So we should also monitor patient for ototoxic symptoms. After the completion of antibiotic course, that is after 4 weeks, we will again perform the culture test to see whether the infection or the bacteria is still there or not. If the culture again came positive, then we will again continue the treatment and we can add some other antibiotic in the regimen. Here is a reference list of different books and a site from where I have taken my case study and the other material. Thank you very much.